Hi, it's Walter Hughes with the Rocky Mount Rotary Club, and we're here to talk about building projects using partnerships. And right now, I will share the screen. And I look forward to having you for this video on good partnerships and how to build strong teams. It's that teamwork that we really want to create. And here's how we do it. The first thing is we start with the dreams from the local community. It's not our dreams. It's the dreams that the local leaders, the men, women, and the children want to accomplish. And it takes listening and getting involved with the community to find out what their dreams are for the future. But if we start with their dreams, then we'll have a good project. And we can't do all that we dream, but we only can do things that we dare to dream. There's 5 concepts to changing lives. The first is we need to have compassion for people that are different from we. And that compassion turns into a passion. And then we tell a story. In that story, as we tell it, we build friendships. And then from those friendships, we build a team. I had never dreamed of drilling wells in Africa, but someone asked that question. And when I saw the need, I developed a passion. And then I began to tell the stories. So here we go. And one of those about a local dream was a chief. And we went into Tonoswano. We drilled a well. And we met the chief that first time when we were learning about the need and creating the need assessment for Tonoswano. And every time I went back, the chief would greet us and ask, "What's your purpose in coming to Tonoswano?" And I would say, "I have lost my heart in Tonoswano, and I have come to try to find it." Well, the second time we drilled a well in Tonoswano, the girls brought bowl after bowl of mangoes. It was amazing, their generosity and hard work. And the boys brought coconuts, the mothers gave us a papaya, and the chief gave us a ram. But it was the generosity and hard work that really touched my heart. And I thought, wow, these kids deserve a future. They need an education. But I had no idea how we would do that. But the chief had a dream. We drilled a well in an immigrant community called a Bonsari. And they saved money, and they showed us their bank's book that showed the monthly deposits into their account to maintain their new well. And a little girl went up to now President-elect Patty of the Signani Central Rotary Club. And the little girl goes, "I have a dream. I want to help people when I grow up as a doctor." And the women in the community of a Bonsari said, "How can she become a doctor? She can't even go to elementary school." Patty went back to the Rotarians in Signani Central and said, "Can we look to see how we can build a school in a Bonsari?" And we did it. That little girl is now going to school. And with all the things that are happening around the world, we need more doctors. We need more people to have a dream. And that dream can start very simply, and people can become a part of that dream. And it doesn't matter your age, you can have a dream. First, we need to create a plan once we have our dream. And the plan needs to be put into phases. We need to have a short-term plan and a long-term plan. And the long-term plan needs to include at least 2 or 3 global grants, not just one. And we need to build a strategy for 2 to 5 years and then for 10 years and begin to see how we can transform communities in a much better way than we are now. So that planning process is really important, and it's involved all the stakeholders on a project. And so now we want to talk about the partners, the type of partners that we have in a project. First are the local partners. Some people call them beneficiaries, but I believe that they are the partners. And they are the leaders that we're working with on this project. And the local partners will tie into regional and national partners as the need arises. And then we will have coaches that will coach us on how to do this project. We have partners who are donors who help to fund the effort. And those donors are local and international in scope. Then we need experts, people who have the knowledge that we don't have to implement this project. And then we need people who can do it, get the job done. And so those partners, we'll talk about in a few minutes, that get the work done. And hopefully each of these groups are helping to get that job done. First piece is the local community. And it needs to be a community-driven effort. And a lot of times when we meet in a community, it's around a tree, and we have benches or chairs, and we listen. We ask them what they want to accomplish. What is your vision, and what is your dream for your community? And how are you going to accomplish that? And we say, if you lead, we will follow. But if you do not lead, we will not follow you. So that's where we create a needs assessment. We call it a strength assessment because we want to know their needs and their strengths and get to know the leaders in that community that can implement this project. We want to listen to all voices in a community, and the ones that have sometimes the best ideas are the women. If it's a water-based project, they're the ones who are bringing the water home to cook and clean and have water to drink. So we've got to listen to the women, and many of them are unofficial leaders in their communities. People look up to them. So if you don't listen to the women and the children, you have missed out on some of the best ideas in a community. And the local Rotary team, this is the Bolgatanga Goodwill Rotary Club in the Upper East region of Ghana. They are a small club, but that local Rotary team, they're helping to change their hometowns and their local communities within their region of Ghana. And so these Rotarians have many ideas and many dreams, and they need to be part of that answer. And it's important to find coaches. This is past Rotary International Vice President Ann Matthews, and she's been a coach of mine for a long time in many aspects of doing projects. And so finding that coach is so vital. They have such a wealth of knowledge about how to maneuver through organizations, how to build a team, how to develop a project, and the kind of scope of a project that we want to accomplish. And we've got to find our coaches because as we're doing the project, there's different ways that we need to be coached. Just like a football team has many coaches that teaches the players. We've got to do the same thing and identify coaches that will help on the different aspects of our projects. And who are the good coaches? Past presidents of Rotary Clubs, past district governors. The district governor is very busy, but once the year is over, that governor is now, the phone has stopped ringing, the emails have slowed down, and they're eager to still continue to transform lives. And so they're a great resource as a coach. The grants chair for your district is also a good coach, as well as the Rotary Foundation chair. And once we're building these coaches, we can get it done. We also need to have champions. And what I call a champion is someone who can help identify funding and identify people and resources. So the past district governors are great champions, and they can identify the strongest clubs in a district where funding can be found. And the champion can also promote the project. So since they were a governor, they know the key players that can support the effort. And the champion can give presentations. The champion can also ask for funding. And they have dealt with the financial issues in a district for a long time. So they know where the money's found. And so they can open doors for that funding that allows the project to move forward. And then it takes working with donors. And a lot of the funding comes from Rotary Clubs all around the world. And it means taking time to ask them. But before you make the ask, you got to tell the stories and tell the way that we will change lives if they help us. And usually a Rotary Club will give between $500 and $1,000 to a global grant. So it's telling the need and telling the impact and how they can make a big difference if they join the effort. And it's important afterwards to tell the donors how their money was used and tell the impact of the project. So you've got to tell that story ahead of time and tell the story when it's done and thank your donors for what they've accomplished through that global grant. And we need to partner across Rotary. And Herb McClarity, we have past district governors who have gone on our projects. And Ann Matthews is cutting the ribbon for a new well. And so when we partner across Rotary, we make a big impact. And so don't just look narrowly at your own district, but look across districts and across zones and across countries to build those partnerships. And it's important to find experts. This expert is Michael Anacozzi. He knows how to repair a well. He knows how to do the diagnostics and knows what goes wrong in a well. And he knows how to eradicate disease and knows how to do a surveillance project. So really whatever you need, he speaks many languages in Ghana. So if you're talking to different communities, he may know the language as well and the culture. So having experts on the subject matter of the project is really important. And we need to turn our weakness into a strength. We do that with partnerships. For example, if we want to outfit a hospital, I am not a doctor, I'm not a nurse. So how can I make a difference? But if I partner with supplies overseas, or SOS is their acronym, they can take $20,000 that Rotary raises for shipping medical equipment And that 20,000 can turn into $40,000 to $275,000 worth of medical equipment. And they know the equipment and they know what's needed in a medical suite for surgery or for a laboratory or a maternal and child health area, like a neonatal ICU. So at that point, they have gathered the medical equipment. We've raised the money to ship it. And together, we have taken something we had known nothing about, medicine, and the organization we've partnered with, they know. So at that point, we have done the best job of supporting the hospital. And that's how we take our weakness, the lack of medical knowledge, and work with subject matter experts and organizations that specialize in that area that we need to work. Okay, we also need to use regional and national partners to plan strategy. And the local Rotarians in country know who they are. I don't run money through a regional or national organization in a country, but when it comes to disease prevention, most times we're working with the Ministry of Health for that country, and they have the surveillance, they have the knowledge to make that happen. So we need to inform the regional or state governors what we're wanting to do within their region or state so that they can provide resources and knowledge for our project. What I don't do is offer to pay them a salary. We explain that they are getting paid by their own government. And so we are not going to pay them extra to do their job. So that's the challenge. And we also explained that none of our funding will go through the national government or go through the regional government, that it will be spent at the local level directly in the community. And if we do that, we avoid a lot of fraud. We avoid a lot of overhead costs that can take away our funding and not really get anything done. So the strategic planning and the implementation comes at the regional and national level. For example, we helped eradicate guinea worm disease from 2 countries. And the Ghana guinea worm eradication program was 2 people. One, Jim Niquette from the Carter Center, and Andrew Saidu from the Ministry of Health for Ghana Health Services. And so together, they made the Ghana guinea worm eradication program. So they knew by region where people were sick. And then they knew by community which communities needed wells where Rotary could drill a well and make a difference. So if we had not worked at the national level, we would not have known where we needed to drill wells. And they coordinated across all kinds of nonprofits to make sure that every community that needed a well could get one, either through Rotary or Catholic Relief Services or other NGOs. So if we had done that alone, one community may have had 3 wells and 2 other communities may have had none. So that's where working at the national and regional level makes a huge difference. Also, a big resource are universities here at home and internationally. And Dr. Mecca invented the microflush toilet. And he was a professor at Providence College in the US. He did research himself, but he had hands-on research by his students, and he was able to prove concepts. So a lot of times when there's knowledge that we don't have, there's theoretical knowledge at the university, And they are very eager to take the theoretical and apply it in real situations. So, and we also have Rotarians who work for universities in Ghana. Sunyani Central Rotarians, many of them work at the Sunyani Technical University. So they can bring resources from their own university to bear on the project. And those students in Ghana can contribute towards this effort. We also have in-country experts. One example are farm extension agents. We provided microcredit loans to buy seeds and fertilizer, to buy chickens and fish and turkeys and guinea fowl, rabbits, and we taught the farmers to work together. The farm extension agents taught them how to do the best practices of raising their crops or raising the animals so that they could generate the most income from their farm. So those experts, a lot of times we don't need to import them. They're in country. We just need to find them and use them and make sure that they are able to teach people what they don't know so that they can be successful. And another example is Steganor Microfinance has expertise on microcredit loans. And so we've given loans for wells, for microflush toilets in this photograph, for small business loans, and all kinds of farm loans. So Rotarians don't know how to be a banker. I mean, some of us are in that field, but bringing in expertise on microcredit loans allows us to be a lot more successful. And finally, when we build all the partnerships, we just need to do it. And this is a Rotarian from my club. She joined Rotary after her husband joined, but she says it's not fair that my husband gets to do all the fun. I need to do it as well. And so she was doing a water test of a water tank at a university to see if the water was safe to drink. And we found that the water needed to be shocked. So bringing this water test with us and for her to use her expertise made a big difference. And we were able to talk at the university and say, hey, we drilled the new well, but you put the new water into the dirty water. And so that water tank that was used from a dirty source now needs to be shocked and cleaned so that the new fresh water is safe to drink. And I really believe in hiring people. We can bring all the jobs from America or Canada or elsewhere to the project, but why not hire local contractors who can also hire additional men and women to solve the situation? And so we built win-win partnerships with the contractors and suppliers and let them know our vision and dream for providing wells. And so we asked for 2 or 3 bids on any contract, but the desire is to have a long-term relationship with these contractors so that their results are dependent on getting the next job. So they know if they do a good job on this grant, the next year's grant and the one after that is open to them if they've done a good job of the current year's effort. And there's so many nonprofit and non-governmental organizations, and they have local experience and knowledge. And for example, we went to South Sudan during a war. So flying around the country and just getting unstuck. If you have NGOs, then they have the strengths like logistics that Rotary doesn't have, or they have the strength of having people in locations where we have no contacts. So those partners, some of them have local knowledge, some of them have strategic knowledge. And it's important to identify the kinds of NGOs that are useful for a project and then go out and meet them and get them involved in the dream and find ways for them to contribute both resources, uh, mind power, financially, and whatever way that they can contribute, get them involved. We want to partner with all faiths because Rotary, I say people of all faiths drilled this well. So when we're partnering with organizations, uh, there'll be Muslims and Christians and Hindu and people of all faiths. So they are the ones working in the community. And the greatest charitable thing a Muslim can do is provide clean water. And it's in the Bible about sharing water to drink. So get the organizations involved. Catholic Relief Services is a great organization and has tremendous resources. So, and then individual churches at home and in country have resources. They can give and they can organize and mobilize a community. So don't forget the faith-based organizations when you're working on your team. I had a district governor who taught me the ropes, and he asked if his son could go with me to Ghana. And this is Chris. He had no idea what Rotary did, but he went to Ghana and he learned how hard it is to dig a hand-dug well. He learned about partnerships and empowerment and so much more. So the best way to get a non-Rotarian to become a Rotarian is involve them on a project. And whether it's planning, organizing, communicating, whatever it is, the people that don't have a Rotary Club or a Rotary District, they may be interested in what we're doing. So ask them. And I've got people who aren't in Rotary who wants to write thank you notes. And sometimes they want to go see the work, and that transforms their lives. So let's add people who aren't traditionally someone in our club, but they have the interest. We are fortunate to have a hands-on generation from Interact and Rotaract. This is Yitzi. Yitzi's girlfriend came up to me at a presentation at the Atlanta International Convention, and she said that my boyfriend wants to do good in the world. How does he get involved? And so Yitzi has helped write 3 or 4 Rotary grants to drill wells and build microflush toilets and to build schools. So he's not a Rotarian yet, but he's done a lot of work that most Rotarians haven't done yet. So don't forget Rotaract. And we've worked with a solar nonprofit that uses Interact students in middle school and high school to build solar panels for classrooms at schools. So let's get the hands-on generation going on building this project. And we transform lives through the partnerships, and we build the dream team. And that dream team, we work with the district chief executive. In America, we'd call them a county administrator. There's water and sanitation department directors. There's medical directors. there's so many resources at a county or district level in a community, as well as the district uh, leadership. And then we work with the informal and formal leaders in a community, which is an assemblywoman or assemblyman, a chief, elders, and people, the students in a community. They can be part of the dream team. And so thank you for this time talking about partnerships. And I am so excited that you took the time to listen to this video. And my encouragement for you is not to forget the partnerships when we're doing this work. And there's so many partnerships that have transformed communities. And sometimes the partnership brings in funding. And the partnerships, we've got Rotary Clubs in countries that are raising a lot of the money. So it's not coming from Europe or Canada or America, it's coming from the African or South American country where the project is happening. And some of the money is needed from elsewhere. So get excited, build your partnerships. And this is Walter Hughes from the Rocky Mountain Rotary Club saying, let's build our dream team and get going. Have a great day.